Assalamualaikum and a very good afternoon to everyone. I'm truly grateful to be part of this discussion today. My name is Nurul Huda Binti Hussin from Malaysia, a diabetes educator, and I'm delighted to share with you the vital role we play in providing specialized counseling during Ramadan for our individual living with diabetes. Normally, we receive a referral 3 months before Ramadan. Therefore, we can analyze and create a personalized plan to ensure a safe and healthy fasting experience for the patient. The best part is we do one-to-one patient counseling at our center, the Diabetes Care Unit of the University Malaya Medical Center. This is my outline for today's presentation. Our aim for Ramadan counseling, a brief on what is diabetes, sharing Islamic point of view, comprehensive assessment on our patient, whether safe to fast or not, and our UMMC Ramadan educational module. The aim of Ramadan counseling for diabetes patients is to provide guidance and support that enable individuals with diabetes to observe fasting during the holy month of Ramadan in a safe and healthy manner. Empower the patient to make the right and safe choice regarding fasting. Diabetes is a chronic medical condition characterized by elevated level of blood glucose. This occurs when the body either doesn't produce enough insulin or cannot effectively use the insulin it produces. Not all patients understand their disease, so as a diabetes educator, it's our role to explain to them about their disease according to their type of diabetes. In Islam, fasting during Ramadan is one of the 5 pillars and it's obligatory for all adult Muslims, provided they are physically and mentally capable. Exception to fasting and individuals who are at risk due to the health condition, including suboptimal control diabetes, may be exempted from fasting. This exemption is based on the principle of protecting one's health and it's supported by Islamic teaching. We do comprehensive assessment on our patient, their medical history, medication, their compliance, their current diabetes management plan, any existing complication, their non-fasting day lifestyle, whether can continue or need adjustment or modification. This information form the foundation for personalized counseling to each patient. As a diabetes educator, I will ask my patient to do the necessary lifestyle changes before Ramadan, then see them back in the clinic within 1 month to review their blood sugar profile and the readiness to start fasting this year. Sometimes patients do not fit to fast, but they want to, so we give them a trial fasting on the white day in Islamic month on 13, 14, and 15 Sha'ban this year. If the patient is able to fast without any complication, such as hypoglycemia, and dehydration, then we will assist them throughout the Ramadan. Whether to fast or not to fast, this we will use IDF DAR risk calculator to calculate the risk of a person living with diabetes before opting to fast. This could include considerations such as age, duration of diabetes, presence of complication, type of treatment, self-monitoring of blood glucose, their previous Ramadan experience, hypoglycemia, awareness, and overall health. This will help us to identify the patient risks and will explain why the results are like that. Therefore, categorize patients into different risk groups based on their individual health status. Our Ramadan educational model at UMMC, we have 8 modules. We will explain to patients their potential risk of fasting, blood glucose monitoring during fasting and non-fasting day, when to stop fast, their hydration, how to avoid dehydration during fasting, meal planning and food choices, physical activity, timing and intensity, medication and administration, adjustment, timing and dosage, management of acute complication. Before and during Ramadan, diabetes educators play a crucial role in counseling and educating the patient. We provide guidance on managing blood sugar level, adjusting medication schedule, timing and dosage, considering the fasting hour and meal schedule and food choices during Ramadan. hydration, physical activity, and lifestyle modification, and also information on risk of fasting for those living with diabetes. Next, we will inform them what is the potential risk of fasting. Understanding the risk of fasting is crucial for individuals with diabetes because fasting, particularly during Ramadan, can significantly impact blood sugar level and overall health. We educate patients on how to recognize signs of hypoglycemia, hyperglycemia, and dehydration, and the importance of regular monitoring of blood glucose level throughout the day to ensure safe and healthy fasting experience. Fasting can lead to both hypoglycemia and hyperglycemia. Episode is essential for diabetic patients to anticipate and manage this fluctuation to prevent complications. Monitoring blood sugar level during Ramadan is crucial for individuals with diabetes to ensure their health and safety during fasting. The timing of blood sugar monitoring is essential to track fluctuation and make informed decisions about medication, dietary choices, and overall diabetes management. Here are suggested schedules for blood sugar monitoring during Ramadan that we teach patients to do. When to test at pre-dawn meal, morning, midday, mid-afternoon, pre-sunset meal before iftar, 2 hours after iftar, or at any time when there are symptoms of hypoglycemia, hyperglycemia, or feeling unwell. When to stop fasting? Individuals with diabetes may need to stop fasting during Ramadan or at any other time if their health is at risk. There are specific situations or conditions in which it advisable to break the fast and seek medical attention, which is low blood glucose, high blood sugar, severe dehydration, symptom of illness, there is an uncontrolled complication, excessive fatigue or weakness, and inadequate medication adjustment. How to avoid dehydration during fasting? Avoiding dehydration is crucial during fasting, especially in the religious practice like Ramadan. Here are some tips we advise to help individuals stay hydrated while fasting. Consume plenty of water during the pre-dawn meal to prevent dehydration throughout the day. Limit the intake of caffeinated beverage. Opt for the caffeinated option when possible. Avoid sugary drink and soda as they may lead to increased thirst. Include water-rich food in your meal. Break the fast with the water and dates as is traditional to replenish fluids and provide a quick energy source. After breaking the fast, gradually rehydrate with water and continue to drink fluid throughout the evening. Rather than consuming a large volume of fluid at once, try to space out your fluid intake throughout the non-fasting hour. If you engage in physical activity, rehydrate after exercise by drinking water. Include food that contain electrolyte to help maintain electrolyte balance. Example include banana, orange, yogurt. Also monitor urine color. Pay attention to color of your urine. Limit salt intake. Pay attention to thirst signal and listen to your body. If you feel thirsty, drink water and do not delay hydration. Meal planning and food choices. Nutritional guidance offer comprehensive dietary guidance to help patients make informed choices during sahur and iftar. Emphasize the importance of balanced diet, including complex carbohydrate, lean protein, healthy fats, and a variety of fruit and vegetables. It's crucial to note that fasting during Ramadan may present challenges for individuals with diabetes, even if their glycemic control is generally good. Maintaining a balanced and healthy diet during Ramadan is crucial for individuals with diabetes to ensure stable blood sugar level and overall well-being. Physical activity, their timing and intensity. Physical activity recommendation provide guidance on maintaining physical activity during Ramadan without compromising health or blood sugar control. Adapt exercise routine to suit fasting hours and minimize the risk of hypoglycemia. Light exercise is unlikely to cause problem. Best to avoid moderate to heavy exercise during fasting hour. Exercise is encouraged 2 hours after iftar. Tarawih prayer could be considered part of daily exercise. Check blood glucose level before exercise and ensure good fluid intake. Medication administration. Review and adjust medication schedule, dosage, or type as needed to accommodate the fasting period and minimize the risks of hypo or hyperglycemia. Provide guidance on the proper administration of medication and insulin during sahur and iftar. We work closely with the patient to make necessary adjustment to the medication schedule, dosage, or type during Ramadan. This should be done in a personalized manner, considering the patient's unique needs. Managing acute complication during Ramadan for diabetes patient to promote recognition of symptom and appropriate action. Encourage diabetes patients to be aware of the symptom of acute complication, including hypoglycemia, hyperglycemia, dehydration, and other potential issues. In the presence of acute complication, the priority is the person's health. Advise the individual to break the fast immediately to address the urgent medical concern. Patient need to manage their hypoglycemia if the patient is experiencing symptom of hypoglycemia. If the patient has symptom of hyperglycemia, seek medical advice promptly. For symptom of dehydration, break the fast with water immediately. For severe complications such as DKA and HSS, seek emergency medical attention immediately. Advise the patient to contact their healthcare provider promptly to report the acute complication. If they are concerned about medication adjustment during fasting, remind the patient not to make any changes without consulting their healthcare provider. Healthcare professional may provide guidance on adjusting medication or insulin doses after addressing the acute complication. Advise the patient to continue monitoring their blood sugar level regularly. Evaluate the patient overall health, especially if an illness or infection contribute to the acute complication. Encourage rest and appropriate measure for recovery. In severe case or emergency, healthcare provider may advise temporarily breaking the fast until the acute complication is under control. Fasting may encourage individuals to pay more attention to the dietary choices during non-fasting hour. This can lead to the adoption of healthier eating habits which can beneficially for overall health. Our commitment extends beyond a one-time counseling session. We actively monitor the progress of patients throughout Ramadan, making necessary adjustment to the counseling plan as needed. This ensures a dynamic and responsive approach to the evolving needs of individuals with diabetes. Experiencing fasting while maintaining good glycemic control may enhance an individual's appreciation for their health. It serves as a reminder of the importance of regular monitoring, medication adherence, and maintaining a healthy lifestyle. In conclusion, our role as diabetes nurse educator is essential in ensuring that individuals with diabetes can observe Ramadan safely and with optimal health. By next year, we will offer teleconsultation for our patients so we can closely monitor them from their home. By personalized and comprehensive counseling to the patient, we contribute to the overall well-being of our patient during this sacred month. Thank you so much for watching my presentation and I open to any question you may have. Thank you.